Right, hello and welcome to everybody who's joined us on this NHS Innovators event. This is our fourth Innovators event, and those who've been with us for all of the events will remember we first had our Innovator event just over a year ago, and NHS is one last week. So we're delighted to have our first birthday, and we're delighted to welcome you all back to this event. We've got around 500 people joining us today, so we're really pleased to welcome so many people onto the call. In terms of the call, we will be recording just to make people aware, and you will be able to ask questions. Just pop those in the live chat, and we're expecting that we will answer a few of those questions, probably not all, but we will be able to respond to those questions after today. So just a little bit more about the agenda today. We're thrilled to have our speakers. You will recall that in October last year, we produced our document Listening to Innovators, which was a response to all of your feedback on the top 5 things that you wanted to help us with. So you identified tech standards, procurement, digital capability, communication, and approach and scale as the top areas that you wanted to have help and support on. And we've worked on these areas with our colleagues from across health and social care. And in this session, we'll be looking at tech standards and digital capability. So as well as those 2 key areas that you've mentioned that you wanted to have feedback and update on our work, we'll be hearing from Tara Donnelly, Indra Joshi, who will update on the AI work that she's doing, and Matthew Gould, who will finish off with a roundup and next steps. So without any further ado, I'm going to add and move over to our first speaker and welcome Tara Donnelly. Thank you, Tara.
Thanks very much indeed, Lisa, and it's really great to be back. We had a beautiful programme in place for the full year back in January, and it was going to take us to some glorious cities, to Newcastle, London, Birmingham across 2020, but lo, it was not to pass. But instead, like the rest of the country, we're learning how to do things in different ways. And a great bonus is that very often when we publish details of these events, within a couple of hours, the places are full. The joy of being digital is we can welcome as many people as would like to join us. So it's fantastic to be able to accommodate more people. And as there are very new people to welcome, I want to say hello. My name is Tara Donnelly. I'm the Chief Digital Officer at NHS. And I'd like to take a few moments to really reflect on some of the highlights. It's a very personal perspective, but some of the highlights from the tech response to the pandemic. And just a word or two to say, what is NHS if you're totally new to us as an organisation? Well, we exist to accelerate the digitisation of health and care, or to put that another way, to give citizens and staff the technology that they need. We're a joint team, as Lisa says. We were established exactly 12 months ago from teams at the Department of Health and Social Care and NHS England to bring together in one place tech strategy, policy and delivery to give coherence and to speed things up. And as you've heard, it was our birthday just very recently. And looking back to that first week of our existence, we ran our very first event for Digital Health Innovators on the 4th of July 2019 at Tech UK, that we subsequently wrote up as the document that Lisa's mentioned, Listening to Innovators. And one of the things you told us is that you really value events where you get to hear firsthand about the work that we're doing, and we get a chance to listen and have feedback from you too. And you asked, would we please keep these going? And voila, hence we are here today. So technology has played a major part in the response to coronavirus right across the world. And our country is no exception. I think the tech response has been nothing short of extraordinary. We've had OpenReach vans deliver donated Facebook portals to care homes to connect shielding residents with their loved ones. A British startup enabling people hospitalised with COVID-19 to return home earlier and use an app and a pulse oximeter to let clinicians review their care as they recover. We have had internet service providers ramping up the bandwidth of clinicians reviewing patients or medical images from home, and another British startup providing video consultation functionality to GP practices. These all happened incredibly quickly, And the examples I mentioned also happened without any charge to the NHS, because these were part of those companies' response to the greatest challenge the NHS has ever faced. At NHSX, we've received over 800 offers of support, several pro bono, and we've sought to make use of as many as possible. And we've also been gifted staff from across Whitehall and from organisations as diverse as the CQC and the Royal Albert Hall, growing at our peak to 3 times our normal size, with the vast majority of those being volunteers who joined us to help. Casting our mind back to the beginning of the pandemic, very early on, it was clear that we would need to rapidly access more hardware to keep services going while NHS staff complied with lockdown and stayed at home where possible. You might remember everyone was after laptops and tablets, and there were shortages during that period that the manufacturing bases in China were closed. And when we spoke to manufacturers, they were really eager to support the NHS, but were concerned about having to let other customers down in order to prioritise frontline workers. So it was really helpful. We asked for a letter of support from the Secretary of State for Health and Social Care to provide some direction at that moment. And since then, 40,000 laptops and tablets have been provided, with around 50,000 video consultations being conducted every day now, as well as thousands more online consultations and through phone calls, keeping the NHS going despite the need to shield and socially distance. We also set up within a few weeks a national deployment support team staffed by the Academic Health Science Networks and other really generous volunteers who worked with primary care locally to achieve this change. And thanks to NHS Digital, all 7,500 GP practices are now connected through GP Connect, meaning it's possible to share critical health records and make appointments between practices. And another thing impacting people early on was access to food, and a team within NHSX worked on this, supporting vulnerable people at home, as well as securing priority food delivery for NHS and social care staff. There was also a huge push on connecting up health and social care, with over 11,000 care homes rapidly onboarded to NHS Mail, using bots to do this as quickly as possible. The rollout of Microsoft Teams has been crucial to the successful overnight shift to home working across the NHS. And you'll have seen that recently we announced a new deal with Microsoft, supported by colleagues at NHS Digital, which will save the NHS some hundreds of millions of pounds a year. We've seen a huge increase in the volumes of staff using the e-learning for healthcare resources, which James may mention in his section, including 1.57 million staff in the NHS and social care accessing the COVID-19 training package, the average rate for last month being 10,000 session launches a day. And one of the most popular advice pieces we've published at NHSX is a very simple, succinct one-pager on information governance and how it mustn't get in the way of good care. Use of services such as the original NHS app have expanded significantly, including for requesting repeat prescriptions, and medicine home delivery has increased markedly, with some of the companies in this space talking about usage having tripled since January. A video made on how to do a video consultation with your doctor has been viewed over 7 million times, helped by YouTube at our request promoting it on their homepage, was part of a campaign that Nicola's been involved in called Health at Home. The number of people accessing 111 online has increased by more than 50 times since January, with almost 3 million online assessments completed. And there have been over 25 million views of the COVID pages on nhs.uk, which has been zero rated by the telcos for the duration of the pandemic. We know that clinical communication becomes even more critical when the workforce is impacted, and so we're running a national procurement to help get tools like this into the hands of more clinicians, and another to help scale remote monitoring platforms that have a role during the pandemic and beyond, as supporting people at home becomes our future focus. We want to support a vibrant ecosystem in digital health across the NHS and social care, as well as work with the 7 regions across the NHS in England to accelerate scale of remote care tools and the connecting up of care homes to health services. But looking back over the past few months, perhaps most importantly of all, we've seen a mind shift change in the public and the NHS alike, with digital solutions being embraced like never before in health and care. There are many examples of more being progressed in digital health in weeks than previously would have taken years. And how do we keep this going? This new appetite for accelerating digital solutions, making decisions promptly and implementing. A change in the perception of risk that has really dogged the NHS in the past. Right now, it feels for the first time more risky to fail to try things than to try things that might on occasion fail. And also a real commitment to both collaboration and scale, with nobody saying they won't use something because it's not invented here, and many saying that they want to scale what works for others. One of the barriers to scale that I have personally found most frustrating in the past is when a clinical or an operational team has found an evidence digital solution that meets the needs of their patients, and yet the cogs of decision making turn so slowly that there's often a real aversion to risk and a simple fear of trying things that are new, that the idea never sees the light of day. And that's one of the things that's really changed recently. We have seen over recent weeks decisions have been made refreshingly rapidly. People are trying digital solutions for the first time, and in many cases they are realising that the fear that they held was unfounded. It would be amazing to keep this mindset once the outbreak is over. So the next stage of work is to embed this, build on it further to truly make it part of mainstream medicine. And we're also mindful that coronavirus may well be here to stay, and that digital solutions that can assist in any subsequent wave should be prioritised and scaled. So we're as ready as possible to keep services going now and in the future. Thank you.